My light on. Welcome everybody, Dr. Natalie Gentile, welcoming you back to Rebels in Wellness. This is a digital content series where we are talking to people in different industries who are rebelling against the norm, rebelling against the standard wellness model. And today I have Dr. Alex Spies. I'm so excited to introduce, to this community, a surgeon who's doing something outside of the norm. So welcome, Dr. Spies.
Thank you.
Can you tell us about what kind of surgeon you are and what you do?
So I'm a plastic surgeon by trade. I did my core training in plastic surgery. I did additional subspecialized training in hand surgery. I'm also subspecialized in peripheral nerve surgery. And for the past 15 years, I've developed both a plastic surgical and more specifically a hand and peripheral nerve practice here in the Pittsburgh area.
Surgical training is no joke. We all know that. I think everybody has kind of gathered that. Did you find, we talk a lot about physician burnout, physician well-being. Did you find that that was a priority in your training?
So I trained in an era which was known sort of the pre-80-hour work week era. The 80-hour work week came about maybe about 10 years ago, where nationally the hours that residents could work in a week was mandated to be no longer than 80 hours during the week. When I was training, it was not uncommon for us to exceed those 80-hour work weeks, especially with surgical training. Whereas a surgical trainee, you are essentially, free labor for the hospital. And it's not necessarily free, but, we get paid a pittance as compared to the attendings that are on staff.
So your practice since residency has been in an employed model, correct? In a kind of what a traditional health system?
Yeah, I would say that I, am fully institutionalized. I've gone, straight from medical school to residency training in a teaching hospital, and from a teaching hospital to another teaching hospital as an attending teaching resident. So, for the past 15 years, I've been, part of an academic system which has been designed to train the next generation of plastic surgeons and hand surgeons.
So what are you doing now that's different? How are you rebelling now?
That's sort of a question that can be answered maybe more than 15 minutes, but I'll sort of distill it down a little bit. I would say that in 2020, during the COVID shutdown, where ORs were shut down to emergent and urgent cases only, I began to realize what life could be like with more free time. I think just like anything, I'm an athlete. I like to run. I run competitively in races, and I think that everybody sort of runs at their own pace, right? And you don't know how fast you're going unless you're on the outside looking in and watching somebody run by you. When you're running, you're just running at the pace that you're running at. And I think that work is the same. We work at a certain pace, and different physicians work at different paces. And I began to realize that I was working at a pace that I was probably not comfortable with, but managing to get by. And I know that burnout is a hot topic now, but it's something that, definitely existed even before the pandemic hit. It just wasn't measured. And if it was measured, the measurements weren't advertised like they are now. Now there's such a big deal about, physician burnout. It's, one of the vital signs that we, try to establish with our trainees. It's just an important part of our everyday life. And I think that during the pandemic, I began to realize that I was probably burnt out from the pace that I was working at.
What's interesting is with that whole physician burnout, there are these initiatives, and some people watching this may not know this. Most people don't know this, that there are initiatives out there within health systems, within training programs to try and help burnout. But I always liken it to the movie Walk the Line, where Johnny Cash goes into the prison and the warden says, well, I don't want you to say anything that will remind the prisoners that they're in prison. And Johnny Cash says, well, do you think that they forgot? And these kind of physician burnout things that we're doing within the system are not changing the system that is causing our burnout. So what are you doing differently then to kind of respond to that pace change?
Yeah, that's a great question. I think, like with any issue that we have in life, we need to identify, what the problem is. It's easy to say that you're burnt out, but maybe burnout is just a feeling. And, what's harder to do is to try to identify, what is the source of that feeling. And I think it took the COVID slowdown for me to realize that the source of my distaste or burnout was the inefficiency with which I was working at. And in that I felt that while I was working at a certain pace, I wasn't getting as much done as I should have been getting done. And it's really until you slow down that you are able to see that real time. And I think that inefficiency that I began to realize during that shutdown became more evident as we began to start ramping up again, but we didn't have the same resources that we had when we had previously. That we had shortages of healthcare providers, especially on the nursing end, which are critical to running hospitals. You'd be amazed at what how important ancillary staff is to running a hospital, and ORs, floors, wards, outpatient clinics. I mean, the ancillary staff are really the blood, the lifeline of the hospital system. And when there are shortages there, it makes what we do as physicians a little bit harder to do, and it compromises patient care and the patient experience overall. And so I began to realize that as I ramped up and I was faced with those shortages, that I just wasn't able to do what I used to do with the same efficiency, and I wasn't happy with the product that I was delivering. So I decided to explore what life would be like if I did it on my own.
How's that process gone for you so far?
It's been interesting. To be honest with you, I had thoughts of going out on my own for years now, probably 3 or 4 years, but never really acted on it. It's like any impulse that we have in life. You have to be faced with a crossroad and sort of decide if you're going to head down one path or another. And I was at that crossroad and decided to head down the path of private practice, leaning on the shoulders of others that have done it in the community, other surgeons that have done it successfully in the community. And everybody measures success differently. For me, success is improving my quality of life, maintaining an ability to spend time with family, and delivering safe and quality patient care, in the specialty that I trained in. And I think that, for the past year, I've been trying to sort of build the foundation of that. We open our doors in July, and then, we'll be able to realize whether or not we're able to deliver on that promise.
Can you tell us about your practice?
Yeah, absolutely. As I mentioned, I'm plastic surgery trained. But I've built a hand and peripheral nerve practice for the past 15 years. I'm leaving UPMC as the program director for our hand fellowship, and I've also been the division chief of hand surgery in the plastic surgery department. So I've got a background in teaching that next generation of plastic surgeons hand surgery. And in doing so, I've been able to build a robust hand surgery practice, but I particularly have an interest in peripheral nerve surgery, and started a peripheral nerve center at UPMC roughly about the time that I started there, maybe 10 years ago, and have developed a practice of interesting patients who have nerve issues that are one standard deviation outside of what the bread and butter plastic surgeon or bread and butter orthopedic surgeon would feel comfortable taking care of. And for me, it's been a very gratifying practice. I enjoy tackling the challenges of those patients, and I certainly enjoy, the success that I'm able to deliver for some, if not all, of those patients. As you probably know, in your line of specialty, there's nothing more important to a patient than having somebody listen to them and hear them and hear what their problems are. And oftentimes, we get busy in life and in practice and don't hear what our patients are telling us. And a lot of times problems are solved just by listening to your patient. And then you're able to figure out, what is bothering them and then find a solution for them.
So I can't believe our time is already up. I'm so moved by this discussion. So I know that both fellow physicians, healthcare workers, and patients are going to listen to this, and it's going to be touching. And it's going to strike a nerve because we've all been patients in some capacity or have had a family member who has been. So what you really said at the end there is so real. So thank you so much for sharing what you do, Dr. Spiess. And we're so excited for you with your next journey with your private practice, and excited to, work together and continue to follow that success. So thank you for your time and for sharing with our community.
Well, thank you. I really appreciate the opportunity.
Great. So until next time, have a good one.
Thanks. See you.